Thank you for joining us today. This is October 20th, and this is our provincial COVID-19 update for today. Joining us today, Provincial Chief Medical Health Officer Dr. Saqib Shahab, as well as Saskatchewan Health Authority CEO Mr. Scott Livingston will be on the phone. We'll have a brief statement by Dr. Shahab before proceeding to media questions for about 30 minutes. We have quite a few people on the line, so we'll likely go through the list top to bottom and then see what we have left for time. Please note that in accordance with spokesperson guidance during the election writ period, the Chief Medical Health Officer and the Saskatchewan Health Authority will provide only technical or factual information and will not participate in debate of programs, policy rationale, or defensive programs as promoted during the course of the election. Thank you. Dr. Shahab, would you like to begin?
Thank you, Karen. So good afternoon, everyone. So just a review of some key points for today. So as you know, yesterday we reported 66 new cases in the province, and today we are reporting 44. And when we average our cases for the past week, it averages to just around 3 cases per 100,000. This is not the trend we want to see in the province, and we can point to several causes. We continue to see cases that are second and third generation from large gatherings. We have had notable super spreader events. Events that have contributed to transmission include a PA event, weddings and parties in both the north and south of Saskatchewan. This is a time when we will also see symptomatic people following any transmission events on Thanksgiving. And while most people celebrate Thanksgiving carefully with their immediate family members or extended households, we have had reports of transmission, and in some cases where people unfortunately went while infectious to not one gathering but several gatherings. So this just shows how we really have to be careful in terms of those close gatherings at home, sticking to a small, consistent group of people. Several outbreaks have now also been declared at nightclubs, and cases as a result of a few nights of transmission will count towards dozens of cases, both as a primary transmission event and secondary events. Small events can lead to significant transmission. For example, in the PA event, there were 60 cases in the first generation, but now up to 107 individuals, including secondary and tertiary spread, have been linked to that event in 17 communities throughout Saskatchewan, and involving now 450 contacts. So you can see how one single transmission event can quickly snowball into a very large impact throughout the province. So not only does this pose a public health risk across a number of communities, but requires a significant amount of health resources to conduct testing, contact tracing, and provide acute care if people become seriously ill. And as we know, we have 18 people in hospital, including 2 in ICU, and we have hospitalizations in every age group, 20 and over. In fact, I can just maybe quickly mention that we have 2 people in ICU in the 20 to 40, 2 people in hospital in the 20 to 39 age range, 4 in the 40 to 59 age range, 6 in the 60 to 79 age range, 4 in the 80 plus age range, and plus 2 people in ICU in the 60 to 79 age range. So this just shows that even though hospitalization and ICU care and unfortunately death is more common the older you are, certainly we have a lot of young people now exposed, and we are seeing hospital admissions in even people 20 years and older. Our earliest measures were intended to flatten the curve and to prevent COVID from overwhelming our healthcare resources, and this continues to be our goal, to reduce case numbers to ensure healthcare services can continue to serve the needs of our residents. But at the same time, we know that as we reopen, more and more people are out work. We enjoy going out as well. We need to do that responsibly. So even though our case numbers may be higher than the summer, and they went from 0 to 5 to 5 to 15, then 15 to around 30. Now they're a bit higher than that, around 30 to 40. We do need to, even at high numbers, keep them stable. We can't see them just rising for indefinitely. And as I said, when we look at thresholds, 60 cases per day is one threshold. That's around 5 cases per 100,000. And then 120 cases a day is a second threshold. That's about 10 cases per 100,000 at a provincial level. But we also need to monitor at a local level if cases are increasing significantly. And we also need to look at the nature of those cases. Can we track and trace all the cases? Because this is important, because if we can understand where transmission is happening, a higher case number is still manageable. But if we have cases where we can't find linkages to one another, then that becomes a greater concern. Secondly, we really need to understand not just the through case finding, not just the venues of transmission, but also the geography. And as you know, we've had large outbreaks with fairly high active case rates in the province, but they were in specific parts of the geography. Now we've had several large transmission events in several parts of the province, and sporadic cases also over several parts of the province. So again, we need to monitor that very closely at both a local level and as well as a provincial level. And if we see a significant increase, especially at a local level, and first of all, we try to manage that through testing and contact tracing. We try to address the consistent measures that we have in place all the time. Staying home if you're sick, physical distancing, mask use when indoors. But if we continue to see an increase in cases in a specific part of the province, further measures may be required, and they were taken in the Northwest. There was public health order in the Northwest, if you recall, in April, May, which had some restrictions, including on gatherings. So we have to be aware that if we continue to see a surge in specific parts of the province, further actions may be required. But we have shown and again that through our consistent public health measures, we can actually reduce case numbers. And now that it's it's fall, it's becoming colder, I think we have to re-emphasize some of those measures. In most of our workplaces, especially essential workplaces, stayed open throughout. They never closed, but they all had very strong standard operating procedures. If you went to get your car repaired or went grocery shopping, you could see that everyone was following those measures, and that kept our numbers low. And then over the summer, I think in some situations, some of those measures were relaxed a bit. And then, like I was saying, over the summer, that once it gets cooler, we'll also have to add another layer of mask use. And now we really have to look at our workplaces, how we're socializing, and make sure that are we staying home when we're sick? Are we maintaining physical distancing from people not in our household? Are we using a mask when we're in a public place? And I think many of us have noticed that in some situations, mask use is very high. In some situations, it is quite low. And we all need to work with each other, with our employers, employees, customers, to encourage high levels of mask use. And finally, I'll just say that, I think while we are seeing an upward trend, and that's consistent with what many other jurisdictions are seeing, we can take measures now that can try to reduce this upward trend. And even if we stabilize at 30 to 40 cases, that's higher than where we were last month in September. But even there, I think that will be a very positive thing if we can really recommit ourselves. And again, large gatherings, even if they're allowable, if they're poorly managed, that's a problem. Small gatherings in the house, again, have to be managed properly. Don't attend if you're unwell. Work with your host to make the event safe. And workplaces, again, is another area where, again, standard operating procedures, mask use or plexiglass barriers, if you're closing the 2 meters with a customer, are important. And even interacting with colleagues in the workplace, maintaining that physical distance, mask use where appropriate in common areas is going to be important, because colleagues and co-workers shouldn't be part of your extended household bubble, and we need to observe the same precautions there as we would in any other public place. Thank you.
Thank you, Dr. Shahab. We'll now go to questions. We'll start in the room. Lynn?
Sure. So when you say considering public health orders for localized areas like in the Northwest, are you thinking about something like that for Saskatoon right now, which has 101 active cases?
Yeah. I think we're watching the situation very closely, and of course Saskatoon is the biggest urban area in Saskatchewan. So we're watching the issue very closely. Now, on the one hand, many of the cases can be linked to specific outbreaks related to nightclubs and bars, and earlier to gatherings and workplaces. So that's really important. The first thing is, stay home if you're sick, seek testing, have your information on hand if you are test positive to give to public health for contact tracing. So that's a really important element to get ahead of clusters. But obviously, if we continue to see sporadic cases pop up without transmission chains being established, further measures may have to be considered. But even before that, I think, we need to just, I had said we need to reset a bubble, about a month ago. Now we need to relook at how do we operate as employers, employees, as customers visiting businesses. I think that's really important. And again, physical distancing, mask use as an additional layer that we are starting to use quite a bit. But I think if we are more consistent with that all the time, when we're in an indoor public place, we can't reliably keep that 2-meter distance. These measures could have a dramatic impact over the next 2 weeks.
Thank you. Mark?
Yes, Saskatchewan hasn't seen this kind of consistent increases in new cases each day yet. With cases being spread out throughout the province, how concerned are you that we are kind of losing control of the spread of the virus?
I don't want to say the word losing control. I think we are seeing an upward trend, and that we are seeing that throughout the province. But I think we have shown that we are able to reverse that through our individual actions, and I think we need to keep focusing on that. And we need to keep focusing on that while we are able to do everything that we're able to do. We should be able to go to a restaurant, but follow the guidelines and do it in a safe manner. We should be able to go and have a drink in a bar, but do it by following the guidelines, sitting at a table, have the drink served, not congregate or mingle. And as long as we do that, I think there's a good chance that we can stabilize this increase in case rates, but we'll have to evaluate, and there may be other factors that may be impacting this. We knew that once we go indoors, that increases transmission risk. But again, it just means that we have to focus again in a lot of situations where we may have popped in to get something, not wearing a mask. This is the time to really put on that mask, even for that brief visit to a retail location. Every little piece counts.
Thank you. Moderator, do you have a caller on the line, please?
We have Stephanie Taylor with the Canadian Press.
Dr. Shahab, at a time when we're seeing case numbers rising and schools are reopened and the amount of community transmission increasing, why are you not discouraging Halloween activities like trick-or-treating? Because some could say that they feel a bit unnecessary given the current spread of COVID-19 in Saskatchewan.
Yeah, so first of all, regarding schools, I would like to say that, we always knew that we would get the occasional case in schools, and the sporadic cases in schools we have seen, it has been actually what we expected to see, and compared to other jurisdictions, actually, it has been less than what I had expected to see, and that again speaks to the tremendous amount of work that teachers, staff in schools, parents, and children themselves have put in. I think children have really been following the guidelines. And we have about, up to date, we've had about 41 cases, mostly with a single case in a school. 20 of them have come out at the other end and now back to routine operations, and 15 still have a single case isolating with some contacts, and about 6 have had 2 or more cases. So I think the schools are functioning well in the current situation. Halloween, again, we have our guidelines online, and what I would recommend really is, I know in some parts of Canada where there's cases much higher than what we are seeing, they have put in, not throughout the province, but specific cautions in specific parts of other provinces. What I would suggest is, as of today, that in most of Saskatchewan, throughout Saskatchewan, if you choose to celebrate Halloween, for children who are younger, go close to your house, go to a few houses who have the lights on and are participating. Follow the guidelines in receiving candy and giving candy, maintain that 2-meter distance, use a pair of tongs, something to give candy out. Tell your children that we'll manage how that candy is consumed, whether you want to hold it or, just wipe it down, but don't have that sharing of candy among children, not in the same household, and not have children reaching into a bowl of candy. And enjoy the day outdoors as a household group. Don't congregate among friends and neighbors who are not part of your extended household closer than 2 meters. See and be seen and wave to each other. And I think Halloween is very popular with older children and with adults, but this is not the time to have indoor parties. This is, certainly dress up, walk around, see and be seen. So I think that's my advice at this time. Obviously, if we need to relook at that closer to Halloween, we will. But, outdoor, physically distant, keeping it small in terms of few households in your neighborhood, I think would be the way to go at this time.
Thank you. Moderator, next call, please.
We have Britton Gray with CJME.
Yeah, I'm just wondering, I know we've talked about that kind of 60 case threshold there per day over a certain amount of days. When it comes to looking at possibly restrictions, would that be something you'd look at if we reach there, more restrictions? And then would it be regional or we go province-wide?
So the actual numbers at which specific measures have been taken in other parts of the world or other parts of Canada have been much higher than 5 cases per 100,000 or 10 cases per 100,000. But having said that, at a provincial level, certainly, we've always used that 5 cases per 100,000 or higher is one threshold that then we will start relooking at several things, and 10 cases per 100,000 is a second threshold. Beyond that, I think what we've seen is that we get a steady increase, but then we get kind of spikes in different parts of the province. And if you look at our active case numbers by geography, they go up and then they come down in one part of the province, and that's what we have to track as well. Now, if we have a large number of active cases due to defined outbreak, that's really a situation where we can manage the contacts, we can isolate the contacts so that the contacts may become a case, but then they don't transmit further because they're already isolating. So then any further restrictions are not required. But if we start seeing increase in cases without a link to a common exposure event and they keep rising, and then we may have to consider local measures at that time. But again, I think we're watching very closely. And we have had experience with the Northwest where there was an increase in cases at a community level. It was managed very intensively, and we got over that. So we have had some really strong experience in the past with those situations, and we'll use those tools and those lessons learned again.
Thank you, Doctor. Next caller, moderator.
We have Guy Quinval from CBC.
Hi, thanks for your time, Dr. Shahab. I'm just wondering, are you considering any restrictions for bars and nightclubs in Saskatoon specifically, given the number of cases in the city linked to nightclubs lately? I'm thinking of things like earlier closing times and mandatory masking. And if you're not considering these restrictions, why not?
Yeah, I think that's a really important point. So the first thing I'll say is that, so far as a sector, bars and restaurants have done really well. Like they followed the guidelines throughout the summer and early part of the fall. We've had sporadic cases, few and far between. Haven't really had large outbreaks, but now, of course, we have at least 2 outbreaks linked to a nightclub bar situation. Second thing is, I think not all, and all of us know that when you go to a restaurant or bar, not all bars are the same. Some are very quiet. People sit at the table and have the drink served. They're in their own group and leave. And I think that those kind of establishments are doing well. For establishments that have had examples of crowding, maybe people using a dance floor that's where it's not really allowed. I think the management of those facilities, which may not yet have an outbreak, really need to look at what's happening. Really, call public health if you want to consult. Otherwise, just re-establish your guidelines and standard operating procedures. And for customers as well, don't leave it up to the business owner to control you. I think we all have a responsibility to ourselves and each other's and the facilities we frequent, to make sure that we don't create situations where you can have super spreading events. So that's my best advice at this time. And obviously, in some cases, there's warning letters, ticketing, and fines to business owners. But if this continues, obviously, my preference would be we focus on those facilities that really have problems with crowding, and not entire sectors which for the most part have not been a problem.
Thank you, Doctor. Moderator, next caller, please.
We have Laura Sharpeletti from CBC.
Hi, Dr. Shahab. Thank you for your time. The Saskatchewan Teachers Federation said today that they believe there's a need to cancel extracurricular activities in schools due to what Patrick Mays was calling a second wave. He's saying it's now upon us. They also want the province to consider providing more directives and resources to schools specifically to deal with this. What are your thoughts on what they have to say today?
So I think, what I would say at this point is that sporting activities, both children and adults, they have been continuing over the summer and into the fall. And again, the same principles apply. There's always a risk with everything, but we've seen that mini leagues have operated safely. And we want to make sure that as extracurricular activities happen within the school setting or within a mini league setting, we have to follow the guidelines. There will be occasional transmission in those settings, but it has to be managed, which means not going to participate if you're unwell, seek testing, keep your contact small. Obviously, when you're playing, you can't always avoid close contact, but if you're sitting on the bench, even with your own teammates and staff, maintain that physical distancing, wear a mask on the bench. And, a lot of other jurisdictions have had problems with that. Before and after a game, kind of socializing where there's a lot of mingling. I think those are the areas that we need to be concerned about at this point. But really support play in a safe manner. I think physical activity, sports are an important part of children, youth, and adults, and we need to be able to support that as safely as we can for the time being, as well as have schools open, as well as have businesses and recreational facilities open. But as long as we try to follow the guidelines, we will see occasional transmission events, but we need to keep that, multiple transmission events happening or large clusters happening. So I think that's what I would recommend at this point. But again, these are things we need to continue to monitor closely.
Thank you. Moderator, next call, please.
We have Matt Barrett from Northeast Now.
Hi, Dr. Shahab. My question, with the cases rising to, I guess, the highest that we've seen throughout the pandemic, is there any thought to expand, where the cases are announced? Like, for example, we have the 32 sort of smaller zones. Is there any thought to possibly make that, even more specific to certain municipalities, certain towns, etc., more than what we've seen now, and, why the process is what it is right now, I guess?
Yeah, that's a good point, and we have looked at that, and there's a couple of things. One is that, when you go much lower than those 32 geographies, you find that people don't really do everything in that one small community. They may go to school here, they may go to work here, they may go to shop here. So I think looking at it as one of those 32 geographies at this point is the most useful. But certainly if there's any additional value to the public by going smaller, I think we can look at that. But at this point, we have looked at that repeatedly, and we find, on our website, we have active cases by the 13 zones on the dashboard when you first go there. And then when you drill down, we have active cases by, those 32 geographies. I think that's serving, I think, our needs well, but we can certainly look if there's any further value to going deeper. But, again, a sporadic case due to travel or some exposure who's isolating at home, wherever they are in Saskatchewan, is not the issue. It's usually those transmission events, and usually it involves people from either a small geography where it's easy to manage, or in some cases from a bigger geography where I think it becomes extremely challenging, like a couple of transmission events. We've had people exposed from the whole of Saskatchewan. So I think, but certainly we can look at that. But at this point, I think we feel we have really good information on the website, including by those 32 geographies.
Thank you. I think can now resume back to the room. Lynn?
Yeah, there were 15 new cases reported today in people ages under 19, I guess. Like, are all of those happening in schools, or where is that, youth transmission happening?
Yeah, I don't have the detailed information right now, but what we've seen we have, and I'll just revise the number. We have, in school-age children, to date, we have had a total of 50 children in 41 schools, but in most, if not all cases, what we see is that the transmission happens in the community, and the child just may have happened to have attended school while infectious, and then the child is then immediately isolated, close contacts isolated, and we have not seen, for the most part, transmission within schools. And I think this speaks to the excellent protocols and layers of protection that schools have. Keeping a child home if unwell, you're limited to your class cohort, mask use where required, as well as in school buses, staggered start and stop times. All those things are preventing us seeing larger outbreaks in schools. And we always knew that if you have a high transmission rate in a community, you will see that reflected in the school setting as well as in workplaces. We've seen that in workplaces as well.
Thanks. Mark?
The Park Ridge Center in Saskatoon, are you aware of that place being closed, and are there any cases at that nursing home?
So maybe I'll ask Mr. Livingston if he has any further details. Otherwise, we could get them.
I don't have any details on Park Ridge today, Dr. Shahab, but we can follow up.
You want to? That's all right. All right. Thanks. Moderator, we'll go back to the phone lines.
There is no one else waiting to ask a question at this time.
Yes, but do we have existing callers who would like their follow-up questions? Or are we coming back to the room?
Back to the room if possible.
All right, guys.
NITHA's also reporting 83 active cases in their Northern First Nations.
I'm sorry, who's reporting?
NITH.
Okay, yeah.
Is that a concern for you, seeing that many active cases in Northern First Nations, and is there more supports going up there for them?
Yeah, so we work very closely with our First Nation partners both on the north and south, and of course I think they are facing a very challenging situation because they've had many cases linked to the PA event as well as sporadic cases, and they are working extremely hard with local leadership in the north, and we as well as Saskatchewan Health Authority are in constant contact with them, working in a collaborative fashion. So at the moment it's busy times for them as well as many people in public health, but it's being managed. And I don't know, Mr. Livingston, would you have anything to add to supports for Northern Intertribal Health Authority?
Only that, as you've already highlighted, we've been working with NITHA since the beginning of the pandemic, collaborating and sharing information, but also supporting each other both through contact tracing and other services. I'm not aware of any outstanding requests from the NITHA group with respect to support from the SHA, but as we've had before with other northern outbreaks, we work together, and if there is a request, we will do our very best to address that for them.
Thank you. Mark, you're good? All right, we'll just do one final check. Moderator, is there anyone else on the line who has an additional question?
Not at this time.
Thank you very much, everyone. That'll be our update for today. Thank you, Dr. Shahab. Thank you, Mr. Livingstone. We will let you know when our next provincial update will be. Thank you.